Welcome to our session on the Tribal CCDF Plan Section 2A, Part 2. In this session, we will cover health and safety training, ratios, group sizes, provider qualifications, the monitoring of child care settings, and relative care. So first, I want to introduce myself. My name is Carrie Stansberry. I am the Tribal Subject Matter Expert for Health and Safety with the Tribal Child Care Capacity Building Center. And I'm going to pass it to my co-presenters to introduce themselves, and I'll start with Gabriela.
Hello, everybody. My name is Gabriela Alvarez. I am the Tribal Subject Matter Expert for Quality Improvement with the Tribal Child Care Capacity Building Center. I will go ahead and pass it over to Priscilla to introduce herself.
Hi everyone, my name is Priscilla Casa and I'm a Tribal Technical Assistance Specialist with the Tribal Child Care Capacity Building Center. I'll pass it back to Carrie.
Thank you, Priscilla and Gabriela. So for part 2 of this session, we're going to focus on understanding the minimum health and safety requirements, flexibilities, and how the various requirements apply to your CCDF program and provider types, including provider training, monitoring and inspection, ratios and group sizes, provider qualifications, relative care, and we're also going to understand what sufficient responses are for Section 2A. So in part 1 of this session, we asked you to consider all of the essential pieces of a child care and early learning health and safety system that must work together to ensure a comprehensively safe and healthy environment for children. So we're going to go over all the components of the health and safety system. So first, your health and safety standards set the foundation and establish clear and enforceable expectations for the providers as part of your program. And they serve as the baseline for monitoring and inspection. And then next, your training requirements ensure that your caregivers, teachers, and directors know what you expect from them and helps providers understand and implement the standards or minimum requirements. Your comprehensive background checks add a layer of protection to ensure children's safety, because knowing who is caring for children is just as important as the environment that they're in. Your staff-to-child ratios and group sizes, or limiting the amount of children under one adult supervision at a given time, ensures adequate oversight and safety for children in care. Setting provider qualifications ensures staff that have the training, education, or experience needed to support children's safety, development, and well-being. And finally, monitoring and on-site inspections of child care providers ensures compliance with all of the CCDF health and safety requirements listed in Section 2 of your CCDF plan, and provides an opportunity to identify areas for improvement or needed support in order to ensure safe and high-quality environment for children. The combination of these components create your health and safety system, and this system would not be complete if one of the pieces were missing or deficient. Across today's session, part 2 of this series, and the comprehensive background check session, we'll dive deeper into each of these required components. But before we dive in, we're just going to take a quick recap of session 1. So in session 1, we discussed a high-level overview of the health and safety system, including core concepts such as entities who have authority to regulate child care provider types and settings, what a tribal standard is, what a state standard is, and we did a deeper dive into the health and safety standards, minimum requirements and flexibilities, and how they apply to your CCDF program and provider types. We lightly touched on relative providers, which we will circle back to today. We also shared a lot of examples of sufficient responses, and we hope that this allowed you to gain a better understanding of CCDF health and safety standard requirements and how they apply to your CCDF program. So you may remember this slide from part 1. We want to remind you that all the CCDF requirements discussed today apply to the same provider types or categories of care you see listed here. In section 1.8, you will select which provider type you pay with your CCDF funds. Those selections there will inform your selection in section 2.2. So before we take a look at the selections in 2.2, we're going to review what was covered earlier. There are 3 CCDF defined categories of care. They are center-based child care, including a tribally operated center, group care provided in a facility outside of the child or provider's home, family child care, which is care provided in a private residence other than the child's residence, and this care can be provided by a relative as defined by CCDF regulations or a non-relative. And then the third category is in-home child care, and this is care provided in the child's home. And this care can also be provided by a relative as defined by CCDF regulations or a non-relative. We understand that some tribes and states choose to create additional categories of care, but these are the 3 categories listed in the regulations. And I'm going to pass it to Priscilla.
Thank you, Carrie. This slide may look familiar to you from part 1 as well. Previously, we shared that these topical areas require standards for childcare providers, but after you have your standards developed, how do you ensure providers and caregivers understand what the standards are and how to implement them? Programs achieve this by requiring training for each standard. All right, so as we reviewed a few slides ago, tribal aid agencies must have training requirements for all individuals who directly provide childcare services to children, which could be a teacher, a provider, a director, or someone who is coming into the child's home to provide care. Tribal aid agencies have the flexibility to determine whether the training must take place prior to working with children or within 90 days of hiring or starting to provide care, or a combination of both. For instance, an agency could decide certain training topics are required prior to working with children, while other topics could be required by the end of a 90-day orientation period. Tribal aid agencies have the flexibility on frequency and training content and on which standards are subject to ongoing training. Tribal aid agencies must include in the training any updates to health and safety standards. Just like for the standards, these trainings must be appropriate to the provider setting type and to the age of children served. Pre-service training occurs prior to starting work. Orientation trainings occur within the first 3 months of hire. Either way, all health and safety topics must be covered in training within 90 days for all people working with children. The second part to the health and safety training requirement is ongoing training, which includes the health and safety topics that need to be completed on an annual basis to maintain your health and safety standards. The ongoing training content should include a minimum annual requirement of training hours to be completed by your caregivers, teachers, and directors, which we will discuss on the next slide. In 2.3 and 2.4, as a reminder, tribal aid agencies are not required to share any policies or procedures concerning pre-service or ongoing training requirements in the plan. Tribal aid agencies will only be selecting a checkbox to certify whether they are meeting the requirements we shared on the previous slide by selecting yes or no. However, we did want to share a brief description of a sample training policy for your consideration. You can read it on the screen. In section 2.6, tribal aid agencies can determine provider qualifications that best meet their community's needs. CCDF regulations do not specify what childcare provider qualifications should be, only that qualifications must be in place appropriate to strengthening the adult and child relationship in the type of childcare setting involved, and how to provide for the safety and developmental needs of the children served. As a reminder, all health and safety requirements apply to all non-relative providers in any of the 3 categories of care. This includes teachers, caregivers, center directors, and any other staff who work with the children in the CCDF childcare setting. Next, we'll look at considerations for provider qualifications. In 2.6, on the screen are some considerations when determining provider qualifications. The tribal aid agencies should only describe those qualifications required to be in place before being hired. Requirements for ongoing employment do not need to be described. Some considerations for provider qualifications may be a minimum age requirement. Many tribes use 18-year-olds. Some have 16-year-olds with someone to shadow who is 18 years or older. A high school diploma or equivalent, maybe a high school diploma or a GED. Prior training or education, for instance, Child Development Associate's credential or a CDA, or an AA degree in child development, or perhaps demonstrating a minimum number of child development hours or credits. And work experience, perhaps a minimum of 6 months previously caring for children. Think about what are some other qualification requirements that your program has in place. We will review some additional options for considerations next. On this slide, we compiled some sample provider qualifications for consideration. Again, these are not CCDF requirements, only options to think about. For center-based care, this tribe has determined that their director must be at least 21 years of age and possess an AA degree in early childhood education or business administration, and a minimum of 2 years experience in leadership capacity preferred. For a teacher, they must be at least 21 years of age, have completed 12 credit hours of child development or early childhood education coursework. Priority is given to tribal language speakers and certified tribal language teachers. For an assistant teacher, they must be at least 18 years of age, possess a high school diploma or equivalent, and have 1 year experience working with children. And priority is given to tribal language speakers. For family childcare, a caregiver must be at least 18 years of age, possess a high school diploma or equivalent, and pass a comprehensive background check, and priority is given to tribal language speakers and certified tribal language teachers. And whereas a teacher must be at least 18 years of age, possess a high school diploma or equivalent, have a combined minimum of 12 credit hours of child development and early childhood education coursework, and maintain a current driver's license. For in-home care, a caregiver must be at least 18 years of age, possess a high school diploma or equivalent, and maintain a current driver's license. Whereas a teacher must be at least 18 years of age, have completed a minimum of 12 credit hours of child development or early education coursework, and maintain a current driver's license. And with that, I will pass it to Gabriella.
Hey, thank you, Priscilla. So this is an excerpt of section 2.5, where you will describe how your program defines the 4 age groups: infant, toddler, preschool, and school-aged, and your standards for ratios and group sizes. Tribal agencies have the flexibility to define what the age classifications are, as the CCDF regulations do not define these. Office of Child Care is looking for a description using ranges and numerals that represent the ages of children served. If your program does not serve an age group, you can enter NA or non-applicable into the description box. Next slide, please. On the screen here, you see an example from 2.5.2. Tribal agencies must have standards for ratios between staff and children and appropriate group size limits for specific age populations. In other words, ratios must be based on the ages, developmental level of the children in care. Let's talk through what each term means and an example. So a ratio is the number of children for whom each child care staff member is responsible for supervising. So for an example, a staff to child ratio of 1 to 10 for 4-year-old children means that one staff member must be assigned to supervise no more than 10 4-year-old children. Group size limits the maximum number of children allowed to be in a care of a staff member, provider, or a team of staff members in a specific setting. Example, a group of size of a 4-year-old children cannot exceed 16 children in a preschool classroom, no matter how many staff members are present. So just note, in a family child care home, the group includes all children who are receiving care at any one time, including mixed age groups. Next slide, please. Tribes have the discretion to establish staff to child ratios and group sizes in a way that best meets their community's needs. This table shows examples for center-based childcare settings across different lead agencies for 2 different age classifications, toddler and preschool. These are examples and not a requirement of minimums or maximums, but you can see that the ratios can vary across agencies based on the things taken into consideration when determining ratios. We have tips and consideration resources on ratios and group sizes in the Section 2 resource directory. Considerations for staff to child ratios, including deciding what the maximum number of children that can be in care and be safely supervised, how to balancing the staffing costs with child safety, needing lower staff to child ratios when providers have children with special needs, or challenging behaviors. For instance, if you have a classroom of 1 staff for 6 children with 6 1-year-olds, but 2 have challenging behaviors, perhaps lower the staff to child ratio to 1 staff for 4 children to help reduce overall stress on the provider and children. Another consideration is lower your staff-child ratios when multiple age groups are cared for in the same room to ensure the youngest children receive adequate care. You can also implement different staff-to-child ratios and group size limits for the different provider settings in your program. Now let's circle back to all of the essential pieces of childcare and early learning health and safety systems that all work together to ensure a comprehensively safe and healthy environment for children. You might remember that we shared that health and safety standards set the foundation and established clear and enforceable expectations for the providers a part of your program and serve as a baseline for your monitoring and inspection of providers. The training requirements you develop communicates your minimum expectations for providers around your health and safety requirements. Your qualification requirements ensure you have the right people with the right credentials caring for your nation's and community's children. Your ratios ensure the appropriate amount of adults and group sizes of children are safe. Your background check requirements add an extra layer or security and assurance that children are with adults determined safe to be around. But how do you know that providers are upholding all of your health and safety requirements? You do that by inspecting facilities or caring settings, observing providers, working with children, talking with providers, and reviewing provider documentation. Monitoring is about holding your providers accountable to your CCDF program's unique requirements. Next, we will talk through the monitoring inspection requirements apply to and what kind of information Office of Child Care is looking for in section 2.7 of the plan. If you would like to support in developing or examining your current health and safety monitoring and enforcement system, TCBC has a developing child care health and safety monitoring and enforcement systems toolkit with guides for each provider type, sample documents, training videos that can support you with developing your system. See the Section 2 resource directory or reach out to your regional program specialist to request technical assistance. Tribes are responsible for ensuring that there are policies and procedures in effect for all childcare providers and settings to ensure that providers comply with your comprehensive health and safety requirements. This includes relative providers unless the tribal agency exempts them from some or all of the monitoring requirements. All providers, regardless of provider type, must be inspected annually and in person for compliance with the following: all health and safety requirements as described in section 2 of your plan, and for fire safety. The Office of Child Care will be looking for these 3 criteria in your responses in 2.7.1. All tribal agencies have the authority to develop alternate monitoring requirements for care provided in the child's home. We will discuss this later in the presentation. So next, we'll review a sample of a sufficient response. So on the screen here is a sample annual inspection brief description that meets what is required in the plan question. So in this sample policy, it states that the providers are inspected at least once annually. Number 2, all health and safety requirements as described in the CCDF plan. And the third one is fire safety. So another example could be where the tribal agency chooses to monitor in-home providers on basic health and safety requirements that affect child safety and background checks. Tribal agencies could choose to focus on health and safety risks that pose imminent danger to children in care and should develop procedures for notifying parents of monitoring protocols and consider whether it would be appropriate to obtain parental permission prior to entering the home for inspection purposes. As another reminder, tribes who pay state-regulated providers are not required to describe the state's requirements or processes anywhere in the plan, including here. The Office of Child Care is only looking for information about the provider types your tribe or another entity designated by your tribe has the authority to regulate. So tribes have the flexibility to propose an alternate approach to meeting the annual inspection requirements for all or some of their non-native relative provider types. For example, A tribe in Alaska could request to do virtual monitoring during the winter months due to the weather conditions. Tribal lead agencies must include a description of how their proposal is comprehensive and protects the health and safety of children in care. The Office of Child Care will not accept alternate approaches that bypass the monitoring requirements altogether. We have a resource on this topic as well in Section 2 Resource Directory. We encourage you to reach out to the Office of Child Care Regional Office to discuss alternative approaches to this requirement. So please note, the PDF version of the plan refers to differential approach to inspection requirements, and that term is being corrected. The correct title is Alternate Approach to Inspection Requirements. Okay, so now I am going to pass it back to Carrie.
Thank you, Gabriella. So who you have inspecting your review and settings is important. We spent the majority of our time talking about a comprehensive health and safety system or systems that must be in place to ensure the health, safety, and well-being of children. Agencies must ensure that individuals who are hired as inspectors or monitors are qualified to inspect child care providers and facilities. This means that they must receive health and safety training appropriate to the provider setting and age of children served. For instance, all of the topical areas for the standards that we discussed in part 1 and earlier in this presentation, your inspectors must know what those requirements are and receive training about what it means or what it looks like to implement those standards across all variety of care settings and across all the ages of children served. Tribes are also required to ensure inspectors have the expertise, experience, or education to comprehensively conduct inspections to protect the health and safety of children served in your CCDF program. Inspectors or monitoring staff should have an understanding of how to inspect the various provider types, as well as be able to produce a monitoring or inspection report for the tribal lead agency to review and be able to make recommendations for corrective actions identified based on the inspection. Training for inspectors or monitors should include the health and safety standards the tribe certified to uphold in Section 2 of the tribal CCDF plan, what each standard means, and how to determine if the provider is meeting them. The CCDF administrator and staff will have to develop both the written health and safety standards, training and monitoring policies and procedures, and an aligned monitoring checklist for each provider type that will help the monitoring staff document whether each provider is meeting the standards that the tribal lead agency has set. Other training topics could include how to handle yourself in the monitoring process, how to understand the standards, and what is needed for a child care program to provide safe, healthy care that helps the children grow and develop and that prepares them for lifelong learning. Lastly, agencies are required to ensure that the ratio of inspectors to child care providers and settings is at a level that enables effective inspections on a timely basis. So in other words, you must have enough inspectors in place in order to inspect all providers on an annual basis. Now, we just want to mention that unlike in previous CCDF plans, you no longer need to provide a narrative response here in Section 2.8. Instead, if you do not have all of the components in place, you would select no. And if you do not have all the components, if you do have all the components in place, you will select yes for each requirement. Now let's explore considerations for qualifications for your inspectors or monitors. So some considerations that you might think about are early education experience, prior required trainings, background checks, cultural education or training for visiting family child care homes and in-home providers. What would you want them to know before entering a native family child care providers or a child or parent's home? Some examples of what qualifications are can be that your monitoring staff or the partner's agency monitoring staff should have experience in monitoring and inspecting child care homes or child care centers based on the different provider types you have. So tribal lead agencies can use relative providers in either family child care or in-home care settings. A relative care provider, as defined by CCDF regulations, can only be one of the following: grandparents, great-grandparents, siblings if living in a separate residence, aunts, and uncles who are the age of 18 and over. It's important to note that while other family members like cousins, for instance, may still provide child care, they do not qualify as a relative care provider for CCDF health and safety exemption purposes. If a tribal lead agency allows relative providers, as defined by the regulations, to provide care in its CCDF program, the tribal lead agency has the flexibility to determine exemptions for relative care providers across all of health and safety. So every component that we talked through and walked through across parts 1 and 2 framed as requirements for all non-relative providers, are applicable to relatives unless your CCDF program explicitly exempts them. This includes the 11 topical standards, the corresponding training requirements, the monitoring and inspection requirements, and the comprehensive background check requirements. Essentially, any aspect covered in all of Section 2 of the CCDF plan can be exempt for relative care providers, with the exception of the definition of a relative. As a reminder, if you allow relative care and you pay non-relative providers, you have the authority to regulate as indicated in Section 2.2. Then you will add the information about the requirements or exemptions for your relatives in Section 2.3 as applicable. However, if your CCDF program only pays relative providers and there are no non-relative providers that you regulate, the Section 2 will not open to you in CARS. You will instead enter all the information about relative providers in Section 2.1 of the plan. So we understand that this is a bit confusing, so please let us know if you have any questions. And we also want to mention that the submission guide also explains this complexity. If you think about the standards that are required for non-relative provider types, you might notice that some can be quite lengthy and detailed and all around not applicable to a relative care setting or too challenging or burdensome to meet. As we have mentioned all throughout these two sessions, tribes have the option to exempt relative providers from standards in place for other providers, or they have the flexibility to develop requirements or safeguards specifically for children being cared for by relatives. So for instance, in sample 1 on the screen, this tribal lead agency decided to include 2 health and safety topical standards about requiring children to be immunized and requiring the home to have electrical covers on outlets and a fire extinguisher. This tribal lead agency also requires relative providers to take a pediatric first aid and CPR training. In order to ensure these few requirements are being met, the tribal lead agency's inspector discusses these items with the provider every 2 weeks. This tribal lead agency exempts relatives from all other health and safety requirements, including the other 9 topical standard areas, the other 10 training topical areas, and all in-person and annual inspection and monitoring requirements. However, they still require verification every 2 years that the applicable standards are being met, and from all background check requirements. So in sample 2, this tribal lead agency chose to develop an environmental checklist for the provider and parent to fill out together. Based on the selections, the tribal lead agency will purchase various health and safety items in order to increase the quality of care. This tribal lead agency also chooses to require a tribal criminal repository background check and exempts relatives from the comprehensive background check requirements. So in this last sample, in sample 3, this tribal lead agency chose to exempt all relative providers from all health and safety requirements. So we invite you to consider whether any of the health and safety requirements make sense for your citizens and your community. So you can think about standards. You could select 1 to 2 topical areas to have a standard. Your training, you could choose to require 1 to 2 topical areas for your required training. Your monitoring and enforcement, you can consider sharing a self-checklist. Background checks, you may consider adding 1 check that contains the most helpful information to ensure safety of children in care. So this brings us to the end of our presentation, and we just want to leave you with some reflections and next steps for you to think about. So think about what additional information do you need in order to fill out Section 2 of the plan related to your health and safety pre-service, ongoing orientation and training, the ongoing training, staff-to-child ratios and group sizes, provider qualifications, monitoring and enforcement of health and safety requirements, monitoring inspectors, relative care, and you also want to think about what sufficient responses are for Section 2A, what partners might you need to connect with about this section, and what questions or topics would be helpful to discuss with OCC. So again, thank you for joining our session. And lastly, I'd like to share how to connect with us. If you are not already subscribed, please do subscribe to our OCC announcements to receive all of the latest information. Also, feel free to email us at occtribal@acf.hhs.gov if you would like to connect directly. Thank you again.